Welcome clients and guests to my channel. I'm Jason Serro and I'm a licensed professional counselor. My videos are designed to educate and empower you to make informed decisions about your mental health. Hey everybody, thanks for tuning in. Today you're going to get an inside look as to the skills and the way that we as clinicians implement these strategies into someone's treatment plan. And today is going to be more about dialectical behavioral therapy, where it has a lot of the skills in each of the components. So you'll be able to take away a lot of skills from this, and you'll be able to put this into your life, whether it's your own therapy if you're in counseling, or you could do this at home. You could watch this over and over and take a look at it, and then there's lots of examples in here for you to take away and plug it into your life. DBT is one of many psychotherapy models. There's tons of them out there, and this one I really like, and I like going through a lot of the skills. There's others that I'll talk about also over time, so this will be a playlist, and it'll be a series of videos, so you'll have these videos in order. And this first one is just about giving you a little bit of background as to what it is. And then as time goes on, you'll see with each slide, there will be some skills really quickly put into these tutorials. So take a look and watch them a couple times if you have to. Take notes if you want to. And ask any questions that you have. Be sure to contact me and let me know what you think, what's working for you, and any questions you have, feel free to reach out. So DBT which has a crossover with cognitive behavioral therapy because of it's very behavior based, and there are also models that are not behavior based. They're more insight oriented, like psychodynamic versions, which I'll get into at a later time. DBT was originally developed by Dr. Marsha Linehan for borderline personality disorder, but it was later found to be effective for anyone to help identify, accept, express, and manage their emotions through effective skills and solutions. Borderline personality disorder is one of the most misunderstood personality disorders that I've ever come across, because it has so many different dynamic components to it. And I'm not going to get into all of it because that's a whole new video and a whole new series, and I want to give the attention that it deserves at a later date, but I'll just give you just some quick background on what it is. It was a very difficult disorder to treat and was unsuccessful in the early years with different models, but it was found, Dr. Linehan really found this DBT to be effective in helping the extreme behaviors and affect and thoughts that people with borderline personality disorder have, because it's based on a fear of abandonment, whether that person is pushing somebody away or they fear that the person is going to get too close and then ultimately leave, so they leave the person before the person leaves them, which can be either real or imagined, they call it. They have chronic feelings of emptiness. Often clients will tell me there's just this real hole in them, or they feel nothing at all. It's that emptiness, and it's really chronic, and it can be daily, but it can also be episodic. And chronic feelings of anxiety. Those are three of the main criteria. Very anxious and neurotic and on edge often. Very protective. And it has, like I said, it has extreme ends, and there's a lot of black and white thinking, and pretty extreme or push it to the limit behaviors, like self-harm and suicidal ideation, which can come out of nowhere. And a lot of these symptoms that come in, along with impulsivity, that come in all at one time, and it's like a storm. It really overtakes the person and floods them and makes them really dysregulated. But it's a very misunderstood disorder. The people actually who have this disorder, I have found to be really good people, very intelligent, care a lot about things, and sometimes too much. They care a little too much about things and take things very personally. So it's very difficult for them to take in all that input and decipher it. It's very difficult to sort it out in a chronological way or an orderly way. And that's part of what DBT tries to do. So I apologize, that was a long rant about borderline. But to continue with this, so in therapy, dialectical or dialectal refers to the therapist helping the client bring together two seemingly opposite concepts and reconciling that conflict or dilemma that happens within ourselves. And often what you'll see is the dilemma has a subset of dilemmas. So one dilemma can branch off. It's like you have a tree trunk, which is the dilemma, and then the branches that go off in the tree is the subset of dilemmas. And it can get very overwhelming and so confusing that therapy is great because it pulls apart those subsets and then you really pinpoint what's going on. Dialectics and Dbt refers to learning the skills necessary while simultaneously learning skills for influencing the invalidating environment in which one may exist. So people that go through emotion dysregulation, they have a hard time controlling their emotions or aiming them, often find that the environment around them is not conducive for whatever it is they're going through. Tough it out, suck it up, you don't feel that way, that's your fault. Those are all invalidating experiences, and they can be both from family, they can be from the workplace, school, peers, just basically telling you that what you're thinking is not right or what you're doing is not right. And it could be very disheartening. Therapy does not focus on maintaining a stable, consistent environment, but instead helps the client become more comfortable with change. This is a very interesting concept. Someone would think of therapy as, well, that's your safe place. And in a lot of ways it is. You go to therapy, you talk to your therapist, you have a very good rapport with them, and it is your place. It helps you see that the environment won't necessarily change, that you have to adapt to the environment in ways that you don't sacrifice your morals, your ethics, your values. You do it in a way that has integrity, but you do recognize that there is something that has to change within you. What DBT has is three main polarities, they call them. And the three main polarities are, the first one is the need to accept yourself as you are in the moment and the need to also change. Is your situation really bad enough in order for it to warrant you to come into therapy, talk about your situation, and say that something has to change? That can be confusing for a lot of people. Well, so how do I accept myself while also acknowledging that what it is that's going on with me is not necessarily working? I shouldn't accept that. What we try to do is we try to come to that conclusion of what you are and who you are in that moment in time is what it is. What is working and what is not working is what helps you in therapy to figure out. And then you talk about your situation to see which direction. And that's where the skills come in. So we put in those skills to see what will help you move to a different goal or a more productive goal. Number two, tension between getting what you need and losing what you need if you become more skilled. I'm here for a problem, but what if I get better? Well, I have to leave. A lot of times in therapy, you go in and you have a really good experience and you get more skilled, but you also develop a bond and a real comfort and it's a real safe and really good environment for you. But it's at a cost. So if you get better, you eventually will leave or at least stop therapy for a while. So it can be a very, very polarizing concept to deal with. Number three, maintaining personal integrity and validating your own views of your difficulties versus learning new skills that will alleviate the pain and suffering. If I get better, I validate my viewpoint that I was not able to help myself and may prove other people's viewpoints were correct when they said I needed help. Oftentimes I'll see in my practice a typical example is a mother-daughter relationship, where if the mother is really dysfunctional in some way or many ways, or we would say maladaptive, has maladaptive patterns of behavior or interaction, and let's say she says she's having conflict with her daughter and she tells her daughter, there's something really wrong with you. You need some therapy. Go get some help. And the daughter reluctantly goes and gets some help in therapy. And let's say that experience with therapy is positive. Well, she's learning, it's a very confusing part for her because she is validating. If she gets better, she's validating, and then her mom sees that she's getting better, and maybe the mother acknowledges that she's getting better. But what if the daughter sees that part of what was really bothering her and making her feel the way she was because her mother was so invalidating? Well, the mother thinks that she was probably right, that she was right all along, that her daughter was the problem. Now things are better. So it's a very, very confusing place to be. What you'll see is that most of us have these internal dilemmas that we bring into therapy. And these are conflicts that we can't necessarily figure out on our own, and we need someone to help guide us, and help us in a team approach pull apart all these dilemmas and see through skill building which direction to go. And then you get to make some decisions based on how these interventions work, and you'll see how that goes over time. Other examples of why people will come into therapy for DBT, or we would utilize DBT, would be, so here's a concept. This person, I love my partner, but I often don't like them or even hate them at times. We look at the relationship and then we ultimately say, is my relationship really what I want? And everything in that relationship, so we would get to very specific points about that relationship and determine, is it, which end of the spectrum has more power or influence? Another example is, I really want to leave my job because it's so stressful, but I can't find another job that pays as well. You have another internal dilemma. You might find a job that pays a lot better than the job that you're in, maybe significantly more. However, there's a lot in between making that move to another job. You have bills to pay. You have to consider maybe childcare arrangements. There are things that you have to move around in your day in order to make that change. And there's a lot of moving parts. And if people are already emotionally dysregulated, having so many transitions, in this example, leaving a job, it has a lot of X factors involved, which again can be overwhelming. So we need to slow it down, and we need to figure out how to do a step-by-step process to problem solve. A lot of this is about problem solving. Another example that someone would come in and then we would do DBT with is, this is more of an identity issue. There are days that I'm really confident in who I am, and other days I don't even know who I am. This is someone that oscillates back and forth between feeling maybe completely confident, which can be an all or none thing, and on other days they don't know who they are, don't know where they're going, are uncertain about the future, very anxious. And so the future becomes so overwhelming that, you know what, the easiest thing to do is, let me just pull the covers over my head, let me go to bed, and let me just avoid it and shut it out. It makes a lot of sense if you think about it. I might as well do nothing because this is too powerful for me to handle. And what we do in therapy is we break it down, we slow it down for you, and we go step at a time. One logical step at a time. It often starts very small. The last example here is, I know if I say what I need, it will be ignored or dismissed and turn into a big fight. Learning the art of negotiation within your relationship and family. This requires give and take, listening, and asserting. DBT talks a lot about the relationship aspect and how to really negotiate, how to best negotiate on your behalf that's not compromising in some way, that you still maintain your integrity, but that you have some give and take. And it's under the premise basically that you have a reasonable partner that you're with. If somebody is unreasonable, you're going to have a lot more polarization than you would if you have a reasonable partner. I hope this first part was helpful. Please tune in to the next video, which will be on evidence-based, the fact that DBT is an evidence-based clinical model. Be where you are, be resilient.